Welcome to Music and Medicine on Monday, a collaboration between the College of Medicine and the School of Music here at the University of Iowa. This podcast is designed to help musicians play and to stay healthy. Today's session addresses management of pain and specifically the role for music therapy in pain management, and even more specifically, around the perioperative period for surgical treatment of children. Supplemental information is available to this podcast on the web from our free website called the Iowa Protocols that can be accessed by searching for Music and Medicine on Monday, the Iowa Protocols. We're coming to you from the recital hall at the beautiful Voxman School of Music here at the University of Iowa. My name is Harry Hoffman. I'm a physician at the University of Iowa, and it's my pleasure to introduce our featured performer, Jada Hunstead. Jada, can you tell us just a little bit about yourself?
Absolutely. I am a master's student here at the University of Iowa in music therapy. I have background in piano and voice since a young girl, and I acquired my undergrad in piano and voice in 2024.
Where was that?
That was at Northern State University in South Dakota. It's my hometown. And I received a music scholarship there, and so I ended up staying with my parents as well, and it was the cheapest option.
Good choice.
Yeah.
And I'd like to introduce Kate Gefeller. Do you want to tell us about yourself?
I'm a music therapy professor, emeritus here at the University of Iowa. I taught for many years in the School of Music here. I also have a joint appointment in the Department of Otolaryngology, where my research focuses on music and hearing loss and rehabilitation for people who use a device called a cochlear implant, which helps them to hear. Some of my research in the past has involved music and pain management. So I'm excited to hear from the rest of the panelists here today on their perspectives on music therapy and pain management.
Terrific. Kirsten Nelson?
Yeah, I'm Kirsten Nelson. I am now an assistant professor of instruction, and I coordinate all the clinical studies here for music therapy students. So their practicums out in the communities and supervising the TAs who provide their clinical supervision. I'm also a board-certified music therapist. I have worked at the University of Iowa hospitals, particularly in the Stead Family Children's Hospital for the last 20 years. And in that work, I was drawn to providing pain management, particularly after surgical procedures. And the one that we spent some time studying was after an orthopedic procedure for teenagers called spinal fusion.
Abby Dvorak?
Hello, my name is Dr. Abby Dvorak, and I'm an associate professor and director of music therapy at the University of Iowa. I am a board-certified and neurologic music therapist. My previous research has included psychosocial and physical needs of cancer patients, and including music-based interventions for pain reduction. I have the privilege of being Jada's research mentor for her capstone, and I currently teach a music and medicine seminar in the School of Music.
Great. Graham Pitcher?
Hi, I'm Graham Pitcher. I'm a pediatric surgeon as a physician at the University of Iowa. I have a very wide clinical practice, including management of trauma, tiny babies born at all stages of gestation, as well as providing the whole spectrum of operative procedures for children. Therefore, I've inflicted a lot of pain on children in my career by necessity, and so pain management is something that is dear to my heart. I'm probably the least musically accomplished of this entire group, I have no doubt, but I have interacted with music therapists such as Kirsten at the hospital, and I've been struck by the efficacy of how much good they do in a broad sense and how much they help our individual patients. So I'm delighted to be part of this group in this capacity and happy to share my views and my thoughts about pain management in children in general.
Terrific. And Tracy Mowry?
Hi, I'm Tracy Mowry. I'm a nurse at the University of Iowa Hospitals and Clinics and certified in pediatrics. I've worked both inpatient and outpatient, particularly with patients that are undergoing spinal fusion, and have collaborated with Kirsten in the past on treating patients with music therapy after their spinal fusion.
Well, this is a great panel, and Kate, if you want to take over and
Sure.
serve the moderator role.
One of the joys that we're going to experience today is having an actual opportunity to observe what it would be like to have music therapy provided to somebody who is in the hospital recovering from surgery. And Jada and her professor, Kirsten, are going to do a little demonstration for us.
What we are about to play for you is something called a music-assisted relaxation, or M.A.R. for short. And what it does is it is an intervention to guide the listener through breathing and breathing exercises and mindfulness to reduce anxiety and pain, through the musical elements, which are repetitive and consistency, as well as tempo is 60 beats per minute to match the typical heart rate. You and your body just went through something really big. Surgery like this takes strength, and healing takes time. It's totally normal to feel however you're feeling right now. Your body is working really hard to heal. And something you always carry with you is your breath. And it can help calm your mind and body. And music also helps your mind and body. When you listen to music, your body relaxes, and less tension means less stress, and less stress can help lower pain. So listen in, let your mind and body rest, while the music and your breath do the work. Get into a comfortable position, close your eyes, and bring your attention to your breath. Breathe in through your nose and out through your mouth. When you breathe out, try to make it longer than your inhale. And this can help lower your heart rate. So we're going to breathe in through our nose for 4 seconds and out your mouth for 8. We'll do it together. Breathe in for 4, 4, and out your mouth. 4, 5, 6, 7, 8. Nice. Now continue to breathe how you usually do. Slow and steady, letting your breath flow with the music. Feel your body becoming more and more calm. And if any thoughts pop into your mind, that's okay. Let them float by like clouds in the sky. And with every inhale, breathe in strength and breathe out relaxation. You are safe and you are strong. Continue to breathe while I sing a slower and softer version of a song you may recognize from the movie or from TikTok. You can sing along if you'd like, or just listen and let your mind rest while your breath and the music do the work. for the world we're gonna make. Now, with every breath, begin to feel more and more awake. Begin to notice the sounds around you, how the air smells. Begin to wiggle your toes, wiggle your fingers. And when you feel ready, open your eyes, take one last breath.
One of the things I love about music therapy is that a good, well-prepared music therapist makes the music sound so easy, like it just sort of came out from the skies. But in fact, I know as a professor of music therapy that there are a lot of decisions that go into what kind of music you play, how you play it, and there's a very important interaction with the patient that you're working with. You have to be very aware of them. Can you talk a little bit about some of the decisions that went into that particular piece of music that you played, and then how that would interact with the patient?
Absolutely. So, as music therapists, we're using music interventions to work toward individualized goals in a therapeutic relationship. And it's very different than simply putting headphones on someone and having them pick some recorded music. I like to think of it with an acronym, LIFT. We use live music in the room with the patient. We individualize to their preferences. F, the music is flexible, and we change tempo and key and style, as you may have heard. And T, we tailor it to their individual needs and their individual interdisciplinary goals that we know about. So, for example, in this one, this would be something we might use when we go into a room after surgery and a teenager or a patient is getting up, maybe sitting up in bed or getting up, and there's some fear involved, and there's a lot of things going on with pain and moving in different ways. And so the music, we want to use the music that is really going to foster that calm response. So music they might prefer, simple, slow, and making it adapted to them. It's designed for the individual with their needs in mind, and it can change on a dime. So if something happens in the room, the music can come back up. In fact, you might have noticed the song got a little faster than the rest of the experience, and that is to increase attention again and get them refocused on what we're doing and getting ready then to move into something different, which was moving on, waking up.
Mm-hmm. If they like really heavy-duty hard rock music or they like hip-hop or something like that, but they're in pain and you want to calm them down, so what does that mean for you as a music therapist?
Right, so we would stay within that genre, but find a selection that could be adapted to a slower performance of it or a slower application, and recreate it in that way for them. So it's still preferred, yeah.
And Jada, it seems to me it would be kind of a challenge to try to actually produce this music on the fly in response at the moment to what the patient is needing, what they're feeling, and how things are changing, as you said, second by second. How do you prepare those skills?
Well, the American Music Therapy Association guides us through musical competencies the students need to develop, which includes a lot of different things. But most basically, they come into a foundational music course where they're learning to play in a lot of different keys and styles. They go into a number of courses where theories and applications are taught. And then they have community experiences. So there you're learning different music for different ages and ways to implement different types of interventions. Mm-hmm. For example, you're with senior adults right now. Mm-hmm. Yeah, and learning all that music.
Yep, and last semester I was with adolescents at a high school, so very different.
So in other words, you need to be able to actually play a variety of styles of music and use the different components of the music in a very, very flexible way. You need to know all sorts of styles of music, don't you?
Absolutely, and you also need to know a bit about the background of the population with whom you're working as well. So along with the musical characteristics that go along with the different ages and populations you may work with are also the foundations of what makes that population them. And so if you're in the NICU, for instance, you're not going to play the same music as you would to a middle-aged adult,
Okay.
things like that.